Hi guys, this is Justin here from Chiropractic Solutions, and I just wanted to discuss one of the more common or prevalent injuries that we're seeing at the moment, which is involving the shoulder. So the shoulder is quite a complex articulation in that there's many things that articulate and can innervate and cause problems with the shoulder before we even touch the shoulder. So the first thing that we need to actually address is the spine. And the reason that we do that is because the spine innervates and controls most of the muscles, ligaments and joints in the shoulder complex. So if it's not working well centrally here, it's not going to allow proper articulation and movement in the shoulder joint. So we need to address, do you have any neck issues? Do you have any mid-back issues? Because if it's not moving well here, it's going to cause overcompensation in the tissue and in the joint structure. So very important that we address this first. Then secondarily, what we need to assess are the ribs. Now the ribs may seem like it have nothing to do with your shoulder, but if you look here on this skeleton, in between the actual spine and the shoulder is the rib cage. So sometimes if the ribs are acting in a dysfunctional way, that can again put excessive stress onto the actual shoulder complex. So then what we then need to do is we need to have a look at the shoulder joint. Okay, so that is involving firstly the shoulder blade. Now as you can see, this shoulder blade sits on top of the rib cage and it needs to track properly with our arm movements. So for example, when we move our arm out as such, this shoulder blade should kind of track and pivot and then come back down. Okay, so if that isn't working well, that's going to again put excessive stress onto the tissues, the rotator cuff, maybe the pecs, or maybe even just the deltoid muscles. But it's going to cause overcompensation in the actual glenohumeral or the shoulder joint. So imperative that we actually look at this shoulder too. Then, once we've determined whether there's any problems at the back here, then we need to actually assess the glenohumeral joint, or otherwise known as just the shoulder joint. Okay. So this is important because this is not actually heavily for example, if we think of the hip is a deep ball and socket joint. So this is somewhat of a ball and socket joint, however it's mainly stabilized by soft tissue. So it's mainly stabilized by the rotator cuff, stabilized by the pectoral muscles and stabilized by your deltoid muscles. So because of the soft tissue that actually stabilizes it, it's not really a solid joint. Okay, so it's very easy to upset in terms of the mechanics. If you fall over, maybe if someone's bumped you from behind in a football match or a soccer match or something like that, it's very easy to upset the shoulder joint. So then we need to assess the actual shoulder and how it's actually articulating inside of it. So as you can see, there's a few areas that can contribute to shoulder issues. If anyone is experiencing any shoulder issues, please don't be shy, let us know about it, and we'll be able to determine that. Or even if you know someone's shoulder that isn't fully settling down, give us a ring and come on down and we'll be able to take care of that for you. Cheers guys.